we're going to see Histoplasma capsulatum. Histoplasma capsulatum is a fungi. This is a dimorphic fungi in which we have yeast form and mold form. The yeast form is at body temperature, 37 degrees Celsius, and mold form in the room temperature, that is 25 degrees Celsius. Here we have the symptomatology is mostly asymptomatic. Asymptomatic could be mild, just like flu-like, more or less, or some other pulmonary mild disease, and could be disseminated. If we have disseminated disease, the presentation are oral or platelet ulcers, hepatosplenomegaly, non-productive cough, pancytopenia, because it involves the bone marrow. All this implies disseminated disease. The treatment depends on which phase we are. If it's asymptomatic, we do not treat it, or we could consider itraconazole. If it's mild or just some level pulmonary disease, like some cavitary lesions, would be itraconazole for 1 year, or a little longer. And if we have disseminated disease, we treat with amphotericin B or liposomal amphotericin B for 14 days, followed by itraconazole. Could be considered for 1 year, and then a lifelong maintenance with itraconazole should also be added. Next, the prevention is just not to be exposed to the caves, because histoplasma is usually seen in explorers of the caves, especially in areas like Ohio or Mississippi River, but also Missouri and the Eastern Great Lakes. But if we don't go there, usually would be fine. Also, immunocompromised patients are at very increased risk of acquired infection with Histoplasma capsulatum. Now, Histoplasma capsulatum is not in the outside of the cells. Actually, it is a intracellular fungi, because it lives inside the macrophage. So if we will see here would be Histoplasma capsulatum inside the macrophage. And because the macrophage can go anywhere, that is how the disease is spread or disseminated. The form that we will see here would be yeast form, and we will see it with many stains. One could be, for example, silver or metamine silver stain, in which we will see the yeast. Also, these are smaller than red blood cells, just to have some idea. And the Histoplasma capsulatum can have macro or microconia, tubular microconia. And the diagnosis is the best, or you say better, best initial diagnosis, the best initial test for the diagnosis, the test for maintenance or monitoring the disease, and for relapsing is the antigen in the urine antigen or serum antigen of the polysaccharides, because this histoplasma has a thick wall. It do not have a capsule as its name would suggest. It just has a thick wall. And if we look for the antigen in the serum or in the urine, usually is the best initial test for the disseminated infection, for the relapsing, and for the monitoring of the disease. The treatment would be again with itraconazole or fluconazole, itraconazole is better, and for severe disease, amphotericin B followed by itraconazole.